Many of you will have questions like, is this safe? Will I be stuck on injections forever? Is it just another weight loss gimmick? Hi, I am Dr. Shiv Prasad. And today we'll talk about advanced anti-obesity medications or dual pathway therapy. I get all your concerns about new medical terms and injectable medications. It is a long-term commitment and it is a lot to process actually. So let me explain actually what these medications are, who they help, and what you should realistically expect from these in plain language and no medical jargon. First things first, let us understand what these advanced anti-obesity medications actually do in your body. Your gut produces two important hormones after you eat. The first hormone is GIP, and this helps your pancreas release insulin when the food arrives. And the second one is GLP-1, which slows digestion and signals your brain when you're full and controls your blood sugar. But this is not the case with obesity and diabetes, where your body actually stops responding to these signals properly because your brain cannot hear the signals like you are full and your pancreas cannot control your sugars efficiently. Let me tell you some newer anti-obesity medications that work through dual pathways and can activate both hormone receptors, the GIP pathway, also the GLP-1 pathway, simultaneously. Think of it like this. If one pathway is a single lane road that is jammed and these medications open a two-lane highway, now that results in a better traffic flow. Now that you understand what these medications actually do, let us talk about what actually happens when you start taking them. 1. These medications will help restore your brain's ability to feel full as you eat less. Not because you are forcing yourself to starve, but because your brain finally gets the satisfied signal. So 2, they help your pancreas to release insulin properly and to reduce the hormone that raises the blood sugar. So your blood sugar comes under better control. 3, these medications also slow down how fast the food you have eaten leaves your stomach. This results in you staying full for a longer period of time. Also, this is not some appetite suppression like a diet pill. This is actually helping to fix broken metabolic signaling. It is important to understand that these medications are not a replacement for healthy eating and regular exercise. They work best as part of a comprehensive treatment plan that includes nutritional counseling, physical activity, behavioral therapy, and ongoing medical monitoring. Remember, they are medical tools, not shortcuts. Now, let me be very clear. This is not an instant weight loss hack or some celebrity cosmetic trend. Here is what actually happens. Your doctor will start you on a low dose, then gradually increase it over weeks. This process is called dose escalation, and it is designed to let your body adjust to the medication and to reduce the side effects. You have to take this medication once a week, and it is subcutaneous injection, which means it is injected just under the skin, like diabetic patients take insulin. The same way, you also inject yourself at home after proper training. You are probably thinking, okay, but what are the risks? So let us now discuss the side effects of these medications. In the first few weeks, many men experience nausea, vomiting, loose motions, and reduced appetite. These are gut side effects, and they are most common when dose is being increased or dose is being escalated. The question everyone asks is, what results can I realistically expect? In clinical studies, when combined with lifestyle modification, some patients using these medications experience significant weight reduction over a period of time, which results vary from individual to individual. Beyond weight changes, some doctors have also observed improvements in the waist size, blood pressure, cholesterol, triglyceride levels. And in people with type 2 diabetes, blood sugar control may significantly improve over time when the medication is combined with dietary changes. It is important to note that these changes build over months, not weeks, and work best with dose adjustment, structured follow-up, good nutrition, and physical activity. Individual results depend on many factors, including their adherence in that complete treatment plan. Now, here are some safety points that you must know. These medications are simply not for everyone. Your doctor will screen you carefully before prescribing them to you. You cannot take these medications if you and your family have a history of specific type of thyroid cancer called medullary thyroid carcinoma. You have a genetic condition called MEN2 syndrome. You have had severe allergic reactions to similar medications. Your partner is pregnant and planning family expansion. you must discuss timing with your doctor. Now, if you develop severe stomach pain that does not go away, associated with persistent vomiting and signs of allergic reaction, then you can contact your doctor immediately. These could be signs of pancreatitis or some other serious issues which occur very rarely. Also, important point, these medications are designed for long-term management of obesity as a chronic disease, similar to how blood pressure or diabetic medications work. The treatment duration and the appropriateness should be determined by your specialist based on your medical response and overall health goals. Now, I know weekly injections sound intimidating and maybe even embarrassing to think about, but this is standard medical treatment like millions of diabetics worldwide manage their condition. It's a tiny needle which barely takes 30 seconds and done in privacy at your home. This is not a weakness. This is actually taking control of a medical condition with advanced medical therapy. Here is what determines the success or failure in advanced obesity therapies. Success is not just taking injection, it is actually structured follow-up. After your first dose is done, the doctor may schedule your week 4 or week 12 follow-ups, and at each visit, your doctor will check how you are tolerating it, what side effects you are having, whether the dose needs some adjustment, and how your metabolic markers are improving. Many men stop treatment in the first 6 weeks itself, not because it does not work, but because they did not stick to a proper follow-up plan or got discouraged by temporary side effects. So remember, when you go back to your endocrinologist or diabetologist, ask these specific questions. Am I the right candidate for 12 pathway therapy given my metabolic profile? What realistic outcomes should I expect in the first 12 weeks? So what is the follow-up plan to manage side effects and to track the progress? Your doctor may recommend medical treatment as a part of your comprehensive care plan. It is up to you whether you take it or not. But if you choose to, then commit to doing it properly with all the medical oversight, realistic expectation, and a structured follow-up. Because half-hearted treatment leads to discouragement and dropout, and committed treatment leads to successful results, and your metabolic health deserves more than a half-hearted attempt. Also remember, some of these medications require ongoing medical supervision, regular follow-ups, and commitment to lifestyle changes that are not suitable for everyone. Do speak with your qualified specialist to determine if this approach is medically appropriate for you, for your specific situation or not. That's it from my side. If this video helped you, then do share it with a guy who needs it more than you. Subscribe to this channel and hit the bell icon so you don't miss the next one.